When I came to Kennedy in August of 2006, I was hired as the stroke program coordinator for the health system, a new position for Kennedy. So my role has been to develop and implement a state-designated primary stroke center at each of the campuses of the health system.
As a stroke coordinator, she is responsible for monitoring and building the stroke program for the health system. She was very instrumental in developing the stroke alert, which draws on resources with the emergency department, critical care areas. She interacts with physicians, nurses, radiology lab, all the different disciplines to really bring together the essence of really good care for patients.
When I met Kathy, when she started as our stroke coordinator, I knew immediately she could take the lead on making us one of the best stroke centers in South Jersey. And she has. We started with primary stroke at Cherry Hill, which under her leadership she initiated, and we now have primary stroke certification across the Kennedy system.
Under Kathy's leadership, the Kennedy Stroke Program has been recognized by the American Heart Association at the gold, silver, and bronze level. We've also been listed by U.S. News & World Report as a best hospital for stroke care.
Since Kathy's been at Kennedy, she's got some notable accomplishments. She started the hypothermia program for the care of very ill patients here. She started a rapid response team, which now is open actually to the families in case they see a change in the patient condition. She also has been very integral in developing our neurosurgical program.
Kennedy's leadership and direction has really allowed me to flourish in the role and to become a stronger, more dynamic nurse and advocate for the patient in the hospital and in the community.
She regularly will go out and educate about the signs and symptoms of stroke prevention, the programs that are available at Kennedy, businesses, schools, churches, community groups. She's out there. One of the really fun things that Kathy was involved with was working with a middle school and the students to help develop a calendar. And I happen to have one right here. Looks like this. As you can see, the students really were engaged with this and really learned. And we've really loved having this calendar to give out to patients and families in the community group.
So one of the interesting things about Kathy Donley is that she's a marathon runner and she does triathlons. And I think those characteristics of resilience and commitment and passion is part of what helps her be so successful at Kennedy. When she starts a project, it gets finished.
I'd like to thank the Nurse Executive Committee for nominating me for this award and the Beacon Award Committee. I'd like to thank my family for everything and all the support and love that they give, and Cheryl Roselli for bringing me to Kennedy.
She is an advocate for patient safety, quality outcomes, and excellence in care.
What makes the job really worth it to me is the difference that I make in a patient's life every day. The patient is the focus of everything that I do, and the outcome should be that there's been a difference in their life.